Hello, everyone. My name is Andrew Trout, and I'm a doctoral candidate and student at Oregon State University Cascades. I'm very excited to be presenting this poster and abstract at ISB 2021. I'm going to be presenting our poster on youth running biomechanics, the influence of footwear on kinetics and kinematics. I'll be presenting on behalf of myself, Dr. J.J. Hannigan, Justin Terhar, and Dr. Christine Pollard, who are all my colleagues here at Oregon State Cascades. The purpose of this study was to compare the running biomechanics in male youth in 3 different footwear conditions. We had 14 participants between the ages of 8 and 12 years old, and we had them all run in 3 different footwear conditions, specifically barefoot, in a traditional shoe, which you can see on the bottom right hand of your screen in the blue shoe, the farthest on the right side, and then also in a youth-specific minimal shoe, which you can see in the image on the left side, or the black shoe adjacent there. We were collecting lower extremity kinematics and vertical ground reaction forces. And this is a new and a unique analysis of the effect of footwear on running biomechanics in youth. So our most noteworthy result were significant and dramatic changes in average vertical loading rate of the ground reaction force when comparing the different footwear conditions. Specifically, barefoot and minimal showed much dramatically increased average vertical loading rate when compared to the traditional shoe. You can see in the graph here that we saw average vertical loading rates that were nearly 2 times the traditional shoe when wearing a minimal shoe and greater than 2 times the traditional shoe when barefoot. This is especially noteworthy because average vertical loading rate has been associated in several pieces of previous research with running-related injury. So the conclusions of this study are that footwear significantly affected the running biomechanics of youth, especially in terms of the average vertical loading rate, as we previously discussed, but also in sagittal plane, ankle, and knee kinematics, which we can discuss in more depth during our poster discussion session. Anyone prescribing footwear to youth should exercise caution in these scenarios, especially when considering barefoot or minimal shoes, due to these immediate and dramatic increases in average vertical loading rate and the association of average vertical loading rate with injury. If a clinician or anyone else is going to be prescribing or recommending these types of footwear, it should be done very carefully and ideally with supervision or with coaching. So that is all that I have for you today. Again, thank you so much for my opportunity to present here at ISB 2021, and I look forward to speaking with everyone during the poster session. Thank you again.